Hello there everybody, this is Valderum. Today I'm going to talk about a couple of anticonvulsants. Now the gist of pretty much every anticonvulsant is that they depress the central nervous system and suppress excessive neuron function. Now the goal of treatment is to reduce seizures to a level that allows somebody to live as normal a life as possible. Anticonvulsants don't just treat seizures, they treat neuropathic pain associated with diabetes, shingles, and fibromyalgia. They also treat migraine headaches and bipolar disorder. There's a couple of different classes of drugs that act as anticonvulsants. There's barbiturates, like phenobarbital, benzodiazepines, like diazepam, GABA analogs, that would include gabapentin, hydantoins, that's mostly phenytoin. Then there's a couple of others, like carbamazepine, that don't fit into these four classes. With every type of anticonvulsant, it's very important that you do not stop taking it abruptly. You really increase your chance a lot of having seizures. It's also important that you don't take alcohol or any other type of central nervous system depressant with this medication, because then you're going to start seeing problems with your breathing and your level of consciousness. Let's get started with phenytoin. I think it's a bit more interesting than the others. It works by inhibiting the sodium channels, which decreases cellular excitability. It's meant to control partial and tonic-clonic seizures, and it has an off-label use for controlling ventricular dysrhythmias. For this drug, you gotta closely monitor the serum levels. They should be between 10 and 20 micrograms per milliliter. Some adverse effects include nystagmus, which is involuntary eye movements, and ataxia, which is a lack of control of your muscle movements. These two indicate neurotoxicity. Other adverse effects are altered level of consciousness, a rash, your urine might turn red or brown, and gingival hyperplasia, which is swelling or bleeding of the gums. You can minimize your risk for that by having good oral hygiene, that means flossing, and by taking folic acid each day. Now, with phenytoin, if you're giving it IV, it has to have its own dedicated line, and it can only run with normal saline. If there's any dextrose in the IV line, it's going to crystallize. Alright, if you're taking this by mouth, take it with food, and it decreases the effects of oral contraceptives, warfarin, and glucocorticoids, so you might need a higher dose. Now we're going to move on to phenobarbital. Phenobarbital works by binding to GABA receptors, so they respond more intensely to GABA. Now if you don't know what GABA is, it's an inhibitory neurotransmitter. It's used to treat grand mal, partial, and febrile seizures. It's also used to sedate people. Just like with phenytoin, ataxia and nystagmus indicate toxicity. Other side effects are drowsiness, sedation. Physical dependence is pretty rare, especially when it's just used for epilepsy. Respiratory depression is another indicator of toxicity. Phenobarbital shouldn't be prescribed to people who have a history of porphyria. The drug is also teratogenic, so it causes a lot of fetal abnormalities. It decreases the effect of warfarin and oral contraceptives. If you're also taking valproic acid, it'll increase the plasma levels of phenobarbital, putting you at an increased risk for toxicity, and you have to taper yourself off of this drug to prevent withdrawal. Alright, we're going to move on to gabapentin now. Gabapentin increases the release of GABA, so it's used to treat partial seizures, decrease postherpetic pain, and treat restless leg syndrome. Gabapentin is a pretty well tolerated drug. Most people don't experience any adverse effects. If you do get side effects, there'll probably be dizziness or sleepiness. It's kind of rare to experience ataxia and nystagmus. Fatigue and peripheral edema, those are also known to happen. Now we're going to move on to diazepam. Diazepam works by potentiating the effect of GABA. It also works as a skeletal muscle relaxant by inhibiting spinal polysynaptic afferent pathways. It's used to treat status epilepticus, alcohol withdrawal, used for pre-op sedation, conscious sedation, anxiety, and insomnia. Side effects include dizziness, drowsiness, lethargy, ataxia, respiratory depression, hypotension if you're giving it IV, rash, and addiction. Last but not least is carbamazepine. It works by inhibiting the sodium channels, which decreases the cellular excitability. It treats partial, mixed, and grand mal seizures, also works for treating bipolar disorder, and trigeminal and glossopharyngeal neuralgia. Adverse effects include drowsiness, nystagmus, ataxia. It can also cause blood dyscrasias, which are leukopenia, anemia, thrombocytopenia. If you're taking this drug while pregnant, it increases the chance of your child having spina bifida. You also experience photosensitivity, so your skin is very sensitive to sunlight. You should always wear sunscreen, and avoid those tanning beds, which you should be doing already. With this drug, you really gotta be worried about Stevens-Johnson syndrome. It's a skin rash that eventually blisters and peels, and it can be fatal. When more than 30% of your skin is covered by that rash, it's called toxic epidermal necrolysis. It's got a very high mortality rate. So the second you see that rash, hold the medication and speak to the physician. Another thing to note is that if you're taking grapefruit juice, it's going to increase the plasma level, so you might have some more side effects. Thanks for watching.